Laplace's law is a fundamental biomechanical principle that explains the relationship between the pressure within a hollow anatomical structure, its geometric dimensions, and the resulting tension or stress on its walls. In cardiology, it is essential for understanding cardiac mechanics, the pathophysiology of heart failure, and ventricular remodeling. In the context of the left ventricle, which is often modeled as a sphere or an ellipsoid, Laplace's law defines myocardial wall stress sigma as the force acting per unit cross-sectional area of the heart muscle. Sigma is equal to P into R whole divided by 2H. Sigma is wall stress, the mechanical burden or tension experienced by the myocardial fibers. This is a primary determinant of myocardial oxygen demand. P. Transmural pressure, the pressure within the ventricular cavity during the cardiac cycle, reflecting afterload during systole and preload during diastole. R. Chamber radius, the internal radius of the ventricular cavity. H. Wall thickness, the thickness of the ventricular myocardium. Clinical significance in cardiology. 1. Concentric hypertrophy, the compensatory phase. When a patient has chronic pressure overload, such as in severe aortic stenosis or uncontrolled systemic hypertension, the intraventricular pressure P increases significantly. According to Laplace's law, this would drastically increase wall stress sigma. To normalize this stress and prevent the heart from failing, the myocardium compensates by adding sarcomeres in parallel. This increases the wall thickness H, a process known as concentric hypertrophy. Because H is in the denominator of the equation, a thicker wall offsets the high pressure, keeping wall stress relatively stable. Eccentric hypertrophy and heart failure, the decompensated phase. In conditions characterized by volume overload, like aortic or mitral regurgitation, or in dilated cardiomyopathy, the ventricle dilates, meaning the internal radius R increases. As the radius increases, wall stress increases linearly. To generate the same pressure to eject blood, the dilated heart must develop a disproportionately high wall tension. This creates a vicious cycle. Increased radius raises wall stress. High wall stress drastically increases myocardial oxygen demand. If oxygen supply cannot meet this demand, often due to microvascular dysfunction in a dilated heart, relative ischemia occurs. Ischemia further impairs contractility, leading to more dilation. Myocardial oxygen consumption. Wall stress is one of the three primary determinants of myocardial oxygen demand, along with heart rate and contractility. Understanding Laplace's law helps us explain why reducing afterload or reducing preload or volume are cornerstones of treating heart failure and angina. Medications like ACE inhibitors, ARBs, and diuretics directly target the variables in Laplace's law to reduce the mechanical burden on the heart. Risk of rupture in aortic aneurysm. Laplace's law also applies to blood vessels. In an aortic aneurysm, as the vessel wall weakens and the radius of the aorta dilates, the tension on the aortic wall increases exponentially for any given blood pressure. This explains why larger aneurysms have a drastically higher risk of acute rupture and why strict blood pressure control is paramount until surgical intervention can be planned.